As part of the fight against the coronavirus, the U.S. has bought up virtually the entire global supply of remdesivir. You may recall that remdesivir is one of two drugs that have been proven to effectively treat the coronavirus. So Dr. Shoshana Ungerleider is here with us now. You are in San Francisco, but you're here with us virtually. Doctor, I want to talk about this. We're talking about a purchase that is 100% of the drug maker's projected production for July, 90% of its production for August and September, plus more for clinical trials. We're essentially boxing out the rest of the world in terms of access to this drug. What does this mean when we are talking about a global pandemic, not just a U.S. problem, a world problem?
Well, what I can tell you, Anne-Marie, is that we know that the investigational drug remdesivir shortens the time to recovery by about 4 days on average for hospitalized patients with COVID. It has no impact on mortality based on what we know. And most experts agree that the current cost of this drug is actually a high price tag for a medication that has not been shown to reduce the number of deaths from the disease. So, I think high level, the goal for any drug that the world needs, especially when it's in short supply, should be finding a way to have a reasonable and fair distribution of the medicine. And it's not clear to me that this is what's happening right now with this deal.
Dr. Ungerleider, you know that the company Gilead signed a confidential licensing deal that would prevent the generic version of remdesivir from being distributed in dozens of countries, including the U.S. Nearly all of the world's poorest countries will have access to the cheaper form of the drug, but developed countries will be charged hundreds of dollars for a single vial. The CEO of the company promised a lower, quote-unquote, government price, but that promise seems to exclude Medicare and Medicaid. So I'm guessing, what kind of impact is that going to have on Americans?
Well, that potentially, a large one. When we have an important medication that is in limited supply, like remdesivir, a government price, meaning a discount, is important. That happens a lot. So this deal apparently only applies, right, to a select group of smaller government programs in the U.S., which, as you said, excludes Medicare and Medicaid. So those who are Medicare eligible are older adults, age 65 and older. These people are more likely to become seriously ill from COVID. And then low-income Medicaid patients are often more medically vulnerable. So I do anticipate Gilead will be encouraged to discount remdesivir to the full group of government programs to make it more widely accessible.
So, Doctor, sort of earlier on in the pandemic, I remember hearing the governor of New York saying that it's very, very interesting that other reasons for other hospitalizations are going down, right? So, like fewer heart attacks, fewer car accidents. And first he sort of said that's because people aren't out and about, so there are fewer car accidents. But then we started to talk about the fact that people were scared to go to the emergency room because they were afraid of being infected. And now what we're seeing is that there is a rise now in deaths that are unrelated to COVID-19, particularly overdoses. What can you tell us about that?
Yeah, so this is an interesting study that came out of the Journal of the American Medical Association. And it's important because what we see here is a death count that's well above what we would normally expect for this time of year. And it can only be partially explained by COVID-19. So between the beginning of March and the sort of end of April, there were 87,000 excess deaths in the US. And 35% of them were not directly linked to COVID. So as you said, some people potentially avoided the hospital, even if they were, very, very sick for fear of infection. There's other reasons for deaths, like delayed medical care, of course, or due to mental health issues caused by distress from job loss. Social isolation, or as you said, drug overdoses. And so we know that drug overdoses, specifically during the pandemic, have skyrocketed. And this is due to several factors, including the fact that Many people are taking drugs in isolation, which makes it less likely that someone would be around to call 911 or give the medication that's designed to reverse an opioid overdose. And we know many treatment programs and recovery centers across the country have scaled back or closed their doors during the pandemic when people need these services the most.
All right, Dr. Ungerleider, as always, great to talk to you. Really important information for our viewers here. Thank you.
Thank you, Vlad.
We just want to remind you, if you or someone you know is struggling with suicidal thoughts, it's a tough time. A lot of people don't have access to their regular support systems. You may be in emotional distress. You can call the number that you see on your screen. That's the number to the National Suicide Prevention Lifeline. It's free. It's available 24 hours a day, 7 days a week. Do not hesitate to reach out and seek help.